Hi, my name is Meredith Keller. I'm one of the nurse practitioners here at AesthetiCare. So at AesthetiCare, we do a lot of different things to treat a lot of different skin types. And one of the biggest questions we get is, can we treat melanin-rich skin? So there's a lot of complications that can arise from melanin-rich skin and lasers with heat, chemical peels. Finding the right provider that has the right education is very important. And as a nurse practitioner, I really highly recommend pre-treating and post-treating with any of the lasers that we do here. So we prevent PIH, which is a post-inflammatory hyperpigmentation. Hydroquinone is one of the medications that we can prescribe, and it suppresses some of that melanin reaction that you get, which is an immune response. When we create melanin in our skin, it's a protection from our skin from the environmental factors, and heat is one of those factors. So hydroquinone suppresses that. In addition, some of the things that we do is some oral steroids or topical steroids. Another option is tretinoin, and that increases the skin cell turnover. So we can pre-treat with all three medications or post-treat, and we figure out the appropriate time frame for you based on your skin type and customize a treatment just for you.
Hi, I'm Kat Toronto with AesthetiCare Medspa. Let's jump into how do we determine what are the correct or safest treatments for you. It's really important to look at your skin type and your health history to ensure that we put together that package that number one fits the safety plug, and then number two gets the results that we're wanting to get. So one of the things that we look at is the Fitzpatrick scale. It was developed by Dr. Fitzpatrick in 1975 and really looks at how your skin responds to the sun. So there's three main factors that we look at. Number one is your eye color. So if you have blue-green eyes, we would say that you are a Fitzpatrick 1-2, and we're going to talk a little bit more about what that means. If you have light brown eyes, you would fall into a bucket of Fitzpatrick 3-4, and if you have dark brown eyes, Fitzpatrick 5-6. Then we look at how your skin responds to the sun. So if you always burn, you never tan, you're a Fitzpatrick 1. If you go out in the summer and you really tried to get a tan, back when you were 16, 17 years old without sunscreen, I would say, how quickly do you burn? And if you tell me, hey, I burn within 30 minutes to an hour, but I can get a little bit of color, I would consider you a Fitzpatrick 2. If in the beginning of the summer I ask that same question, or as an adult I'm asking that same question when you were 16, and you tell me, I burn, but I probably just burn in the beginning of the summer once, and then I can kind of get a tan, I would say you're a Fitzpatrick 3. If you tell me, hey Kat, I really don't burn, I just tan, Fitzpatrick 4, and then Fitzpatrick 5s and 6s don't burn as well. And so when we look at the Fitzpatrick scale, it really helps to educate us on how much melanin is in the skin. The light from that laser gets absorbed by melanin and generates heat. And so if we use a device that is highly absorbed by melanin and generates too much heat, that's where a lot of complications can come into play. So Fitzpatrick scale is really important in helping us to determine a safe and effective treatment for you.
Hi, Vanessa.
Hi.
It's nice to meet you.
Nice to meet you also.
My name is Keela.
Keela,
I'm one
okay.
of the estheticians here at AesthetiCare.
Okay.
And I hear that you are here to talk a little bit about some different things today that you are concerned with your skin. Why don't you kind of run through some of your questions for me?
Okay. Well, generally my skin does really well, but lately I've noticed, I don't know if it's age or being out in the sun more, I've been developing some of this. I discovered it's called hyperpigmentation.
Okay.
I didn't even know the name of it at first. So, and it's just on one side. So that's a little concerning.
Okay.
And just in general, during the winter months, I tend to be more dry.
Okay.
And just doesn't seem like the moisturizers that I use are really that helpful.
Sure.
So yeah.
I understand. So do you feel like your hyperpigmentation is more kind of on the left side of your face than it is the right? Okay.
Yes.
Okay.
I don't really see it on the right like I do on the left. So.
Okay, perfect. So
yeah.
Kind of what I like to focus on in my consultations is really about education.
Okay.
Because I feel like when you are able to better understand why your skin does what it does, then it makes it make a little bit more sense on why we treat it the way that we do, and also with skincare, kind of why we use certain things in our routines for different conditions. So, as you know, you have melanated skin is what we like to call that, or melanin-rich skin.
Yes.
And you're what we would classify on that Fitzpatrick scale as a Fitzpatrick 6.
Okay.
Meaning you have dark eyes, you have dark hair, you have dark skin, and you've probably never had a sunburn before.
Correct. I am in the sun with no issues, but I still use sunscreen or sunblock.
And that's what we love to hear. That is so great. So melanin is actually what gives our skin the color, our skin, our hair, and our eyes.
Okay.
And believe it or not, we are actually all born, no matter what ethnicity or race you are, we are all born with the same amount of melanocytes.
Really?
Isn't that crazy?
Yes, I know.
So we all, me and you, we have the exact same number of melanocytes, but our melanocytes produce different amounts of melanin.
Okay.
So I don't produce as much melanin as you do. So I tend to maybe not have those same hyperpigmentation problems that you have.
Okay.
And the main causes of hyperpigmentation are sun, hormones, and inflammation.
Okay.
So typically, if we can kind of address those three things, we can get a really nice resolution with that. You know, something that we use to treat hyperpigmentation quite often is going to be what's called our AMP peel. It's technically our AesthetiCare Medspa peel. It's kind of what that AMP stands for. But it is a hydroquinone and a tretinoin-based chemical peel.
Okay.
It also has a little bit of that kojic acid and that citric acid that we talked about too. So it's a 2-step in-office mask treatment, and then you have a little home skincare regimen. So it's about a 60-day course of treatment.
Okay.
And
2 months. Okay.
About 2 months. Yep. But it is very, very effective for treating that hyperpigmentation.
And is it, like in terms of some of the peels, I know you can't be in the sun and all of that, is that applies to that as well?
It does, yeah, definitely during your course of treatment, and really with anything that you do, we want you wearing that sunscreen of at least a 30, and we really want you protecting your face from the sun.
Okay.
You know, wearing a hat, wearing your sunglasses, you know, making sure that you're not getting that direct sun exposure.
Okay.
It's really going to be best. So that AMP peel is a really good treatment option for hyperpigmentation.
Okay.
We also have a couple of other options that are really good too. You know, we use a laser technology that is called Moxie.
Okay, I've heard of Moxie, but I don't know what it all entails, but I have heard of it.
Yeah,
okay.
Absolutely. So, you know, laser treatments, they get a little bit of a bad rap when it comes to treating melanin-rich skin, because the technology in the past has not been very friendly. You know, the risks that are involved, you know, there have been burns, there have been scars, there has been hypopigmentation where the skin is lighter in certain areas and that pigment doesn't tend to come back.
Okay.
And that's really with older technologies. And we were really limited in those treatment options. But the beauty of it now is that we have the ability to treat all different skin tones with these newer technologies, like the Moxie laser.
Okay.
So it's a non-ablative laser, meaning we're not actually burning any skin off of the surface here. So that really is the main thing that makes it so good for melanin-rich skin, is we are not causing any trauma to the outer layer of the skin. Moxie laser is great if someone is looking for a skin polishing treatment. So if you're concerned about your pore size, if you're concerned about the texture of your skin, you know, fine lines that are starting to form kind of right on the superficial layer, and that hyperpigmentation or melasma.
So for things like the Moxie, those treatments, is it something you have to repeat on a regular basis, or is it to maintain the look? Okay.
Yeah, that's a really good question. So with the Moxie laser, sometimes we do recommend a series initially in that treatment, and that's really dependent on the severity of the pigmentation that we're looking at. You know, if someone has a lot of severe hyperpigmentation, which looking at your skin, you don't have.
Okay. I was going to ask you that question next.
You know, you don't have, you know, any of those dark spots like the acne marks, or, you know, you don't have severe melasma. Sometimes we'll recommend an initial series of about 3 of those treatments.
Okay.
We'll kind of treat you once a month or once every other month, depending on, you know, how often you're able to come in. And then maintenance really is kind of dependent on you. We usually recommend doing it about once or twice a year to maintain your results. Because, you know, our skin is a living, breathing organ. It's constantly turning over and it's constantly changing. And, you know, unfortunately, we can't go to the gym one time and get
the results you want.
Get ripped. And, you know, you
can't just do one push-up.
Can't just do one push-up, unfortunately. But that is a really good question, because maintenance-wise, that's kind of what you would look at.
Okay.
There are other lighter treatments that we can do depending on the type of hyperpigmentation concerns. If people have some pigmented acne scarring or some pigmented or textured acne scarring, microneedling is actually a great treatment for that.
Now, what does microneedling do?
Yeah. So microneedling is what we call collagen induction therapy. So the idea behind that and the device that we use the Skin Pen microneedling device. It is the only FDA approved device for microneedling.
Okay.
And it is safe to treat for all skin tones. It has been clinically tested for that.
Okay.
And what it does is it uses a little head with about 11 needles on it, and which sounds really scary, but we numb you. You are very comfortable during the treatment.
Okay.
With a topical numbing cream. And we basically create thousands of little microchannels in the skin.
Okay.
And by doing that, we are tricking the skin into thinking that it's injured, and so it goes into overdrive healing mode. Starts rapidly producing collagen and elastin for remodeling.
Okay.
It is excellent for pigmented acne scarring. It's excellent for textured acne scarring.
Okay.
So both of those are great. And really, if anybody has, any sort of dark marks that maybe aren't caused by acne, it's great for treating that as well. And for somebody who's maybe still a little hesitant of a laser treatment, but you're still wanting that benefit of the anti-aging, microneedling is a very safe, very easy downtime treatment that you can kind of dip your toe into the pond of, deeper aesthetic treatments without jumping straight to a laser.
Okay. Well, that's good to know.
Yeah, it's always a great option. And, sometimes we will pre and post treat with that hydroquinone cream that we talked about.
Okay.
Just to help make sure that we don't have any sort of adverse events when it comes to that hyperpigmentation.
Okay.
Because as you know, anytime we cause an injury to the skin, whether it be a little cut or, a little poke, those melanocytes, they can kind of go into overdrive and in response to that injury. So what we will usually do is we'll kind of have you on a short course of that hydroquinone beforehand, and then we'll have you use it a little bit afterwards, just to make sure that you're protected during that time.
Okay. So I do have another question, and that relates to hair on the chin.
Yes.
So what are some of the things that I can do to help with that?
Absolutely. That's a really good question. So probably one of the best things that we can do for that is going to be laser hair removal.
Okay.
Now, again, laser hair removal has gotten a bad rap in the past because we've been very limited in our technology on how we can treat melanin-rich skin. In the past, the technology that has been used has been an intense pulse light technology, or what we call IPL. You may have heard of that before. And it is a single wavelength device. It targets the melanin that is in the hair shaft.
Okay.
It's an effective device, but the problem with treating melanin-rich skin with that device is not smart enough to be able to distinguish the surface melanin and the hair shaft melanin. So it just heats up that entire area, no matter what. It's not smart enough to see the difference. And so what that means for melanin-rich skin is we run the risk of burns, and we run the risk of that hypopigmentation that we talked about, which is obviously not what we want to do.
No. So what I also have heard is that it can't distinguish between black and gray hair.
That is correct.
Okay.
Yep, that is correct. So the device that we actually have here at AesthetiCare is our laser hair device. It's called the Clarity 2. It's made by a company called Lutronic, and it is a very versatile device because we have the ability to switch between two separate wavelengths. So I can treat every skin tone on that Fitzpatrick skin scale, which is just revolutionary. The wavelength that we use to treat melanin-rich skin is going to be a 1064 ND YAG. I know that doesn't really mean a whole lot to you, but the beauty of that technology is that wavelength actually does have the ability to distinguish between the melanin on the surface of our skin and the melanin in that hair shaft. But you are right, it does not treat gray hairs. So gray or white hairs, it doesn't have the melanin in that hair shaft that is needed to drive that heat down to that blood source and be able to coagulate that blood supply so that hair follicle can't grow anymore. It's kind of like a white sidewalk, it's going to reflect the sun, whereas a 4-lane black highway is going to be able to draw that sunlight in and heat up so well. And so we just aren't quite there yet on technology to be able to treat those really blonde or white hairs. But the 1064 Indiag is very effective for brown and black hairs. We can get really 80 to 90% hair reduction with a series of treatments. And we can get you to where, you know, most people are plucking or shaving, but we can really get it to where you're not having to do that, you know, about once, maybe every 6 months.
Oh, really?
And you know, we have you come in for your maintenance treatments. The problem with this area here is it does tend to be hormonally influenced. So that's something that we kind of have to battle as well. You know, my clients who have certain conditions like polycystic ovarian syndrome, it causes some more androgenic hair growth on the face and other areas of the body. There's a genetic condition that's called hirsutism that causes androgenic hair growth in females as well. And then anytime we're on any sort of artificial hormone replacement therapy. So a lot of women who have gone through menopause or who have maybe had hysterectomies are going to be taking, you know, some progesterone, sometimes some estrogen and some testosterone.
And that makes it,
and that can stimulate hair growth. Something else that we kind of like to talk about, and what I like to talk about with my clients, is taking any sort of hair growth supplements, because that's not typically something that will pop into people's mind. But I've had clients who, you know, come in and we've done some treatments and they say, you know, I'm having this new growth, and so I stop and I say, okay, let's go through your medication list again. Run me through what you're taking. And they say, well, I started taking Nutrafol. And I say, well, that's a hair growth supplement. It doesn't know to just go to your head. It's going to go everywhere. So that's something that can also influence that hair growth. But laser hair removal is very effective. Using that 1064 Indiag, we can really treat, you know, melanin-rich skin. We can treat dark hair follicles. As long as it's dark hair, it will be very effective for that. And really, you know, something else to kind of consider too, and something that I've experienced with some of my clients who do have darker skin tones, is the repeated plucking or waxing or even threading can actually cause pigmentation issues in these areas too, and sometimes even on the underarms, in the groin area. It can be a combination of the trauma to the skin and then sometimes friction in these areas too. And so when we're able to eliminate that hair in those areas, then we can also start fading that hyperpigmentation, because we're not having that repeated trauma to the skin from either the plucking or the waxing or the threading. And so that can really help a lot with the hyperpigmentation that's experienced in those areas as well. And same thing, you know, with the underarms and with the groin area, you know, whether it be razor burn, that can contribute to hyperpigmentation in those areas, or just general friction and irritation. And so when we eliminate that factor from the equation, it can really help to alleviate those concerns.
That's good to know. Thank you.
Hi, my name's Christina Frazier, and I work at AesthetiCare. But well before that, I was a client at AesthetiCare. I've been a client here for over 20 years. As I've gotten older, the main issues that I have with my skin right now are hyperpigmentation and melasma and adult acne. As we get older and we're in perimenopause and menopause, we can also have hormonal imbalances, which is what my problem is right now. Some women have PCOS or metabolic syndrome, and that's another situation where you have imbalances in your hormones that can kind of manifest by having problems with your skin. I'm really focused on the Moxie, which is another laser treatment. But the Moxie works more superficially, more on the top layers of the skin where melanin resides, and it really helps me with discoloration. So melasma is something that I started to have about 10 years ago. It kind of looked like my face was dirty in spots, or I kind of had a shadow on my face. But of course, I do the treatments here, so it really helps suppress that. And then the adult acne, that typically is along the jawline. That also can come up if you have PCOS. And so because this is a medical spa, I was able to get a prescription for that problem With the inflammation, I was also able to get home care products. AesthetiCare is the only place I would go anywhere in the Midwest or definitely anywhere in Kansas City for my skin, because my skin's sensitive and I also have a tendency to hyperpigmentate. And so I know that I'm in good hands here at AesthetiCare. Come with a few things that you want to discuss at your consultation. You're in a private room with one provider, so it's very intimate, and you can just really just talk to your provider and they will just educate you and give you some options. All the things I've discussed, I did over 20 years, but you certainly can just start small and do little things incrementally. And I think that when we improve our skin and we improve how we feel about ourselves in little bits, it can really compound and become a profound change in our life. Having somebody give you a plan so that you can get your skin in better condition is something that we can do here, and it's super easy. So I really recommend that you make your free consultation today, and I hope to see you here at AesthetiCare.
Hi everybody, I'm Keela. I am the medical esthetician that you just watched in the video. I am really excited to talk to all of you and start answering some questions here. We've had some questions kind of coming in as we've been going through the video here, so I'm going to go ahead and jump into that and get into some answers here. So the first one that kind of came across here just said that at AesthetiCare, she's been told by some nurse practitioners that she does have melasma, and then another told her that she does not. How do I know which treatment is best? So melasma is a really difficult condition, both to diagnose and to treat. And I really want to stress that none of the estheticians here, it is outside of our scope of practice to truly diagnose anyone with a skin condition. So I want to preface that and really stress that information. The only way to truly have a diagnosis with melasma is going to be going to a dermatologist. So if you really want that yes or no, like yes, you have it, no, you do not, you really need to be seen by a dermatologist and get kind of an official diagnosis. Now, that being said, you know, melasma is treated really similarly to a lot of other hyperpigmentation issues. And so whether you know that you have it or you don't, we can still come up with a really great plan to treat the pigmentation issues that you're having. We can treat it as if it is melasma. So we can say, hey, you know, we need to be avoiding these stressors with the skin. We need to be protecting our skin with a mineral broad spectrum sunscreen every single day, even if you're not going to be outside. We need to be practicing good sun protection in the form of hats and large sunglasses, things like that that are providing that physical protection from the sun. I've had clients who really love their hot yoga or their infrared sauna, and they say, but I notice that my pigmentation comes out more whenever I do my hot yoga or after my infrared sauna sessions. And that is very indicative of a symptom of melasma being worsened by heat and being worsened by light. So we can still treat it that way, even if we don't have like a specific yes or no diagnosis. But certainly if you want that diagnosis, I totally understand. That is something that you will have to see a dermatologist for. We have great dermatologists that we actually can provide a referral for. But the Vizia skin analysis is always a fantastic way to get a really in-depth 3D look at your skin, where we can see pigmentation patterns that can be indicative of melasma without, you know, providing a for sure diagnosis. So I hope that helps, you know, with that question. The other question that I wanted to address here, I've had several kind of pop up on treatments for under eye circles, whether it be hollowing in the under eye area or dark circle treatment. That is probably one of the biggest problem areas that I deal with clients. And it's totally understandable. You know, the skin that is underneath our eyes, it's actually the thinnest skin on our entire body. So the thickest is the palms of our hands and the soles of our feet. This under eye skin is very, very thin. And so what tends to happen is we can have more visibility with the veins that are underneath our eyes. That can lead to the appearance of shadowing and dark circles, especially if we're someone who we wake up in the morning and we're really puffy. Sometimes that can be more genetic. Sometimes it can actually be in relation to certain medical condition. We do find people who have thyroid issues tend to have darker circles under their eyes. Chronic allergy sufferers tend to also have dark circles. So it can be medical as well, and something that I do kind of counsel my clients on possibly talking to their doctor if it's something that they notice, hey, I've always had these. It can even be indicative of some sleep apnea, some sleep disruptions. And so I can say, hey, you know, we can work in conjunction with your medical doctor if this is something that you've noticed that you've always had. Now, if it's something that is new and it's something that, you know, if we push in this area and we don't see a capillary refill on that, it could be hyperpigmentation. And that is more common with clients who are more along that Fitzpatrick 4, Fitzpatrick 5, Fitzpatrick 6 skin scale, where we are more prone to hyperpigmentation up underneath the eyes. And that is where things like the chemical peels, the Moxie, and even some microneedling, because we can go very close up under the lash line without going above that orbital rim. I actually take my hand and I pull down really tight so we can get right up close to that lash line when we're microneedling safely and effectively to help with the pigmentation. We also have a fantastic eye cream. I know eye creams are kind of a dime a dozen. You go to the drugstore and you're looking at that wall and there's just like thousands and you're like, where do I start? But this is a medical grade eye cream. It's made by Revision Skincare. It's called their C+ Correcting Eye Complex. And what it does is the ingredients in that product actually address the vascularity issues that occur up underneath the eyes. And then it also does help with hyperpigmentation issues. It has been clinically tested and shown to address both of those issues. So that would be something that I would absolutely recommend my clients to incorporate into their routines if they suffer from either one of those conditions. And again, that's something we're sitting down and talking and utilizing that free consultation that we provide here at AesthetiCare is really going to help, because we focus on education during that consultation. We don't focus on selling you. We focus on strictly educating you about your skin, what we're seeing in your skin, and how we can get you to your skin goals. Let's take a look at some other questions here. We've got one here. It says, I've tried everything for melasma. Now it's way worse. What treatment can I do for it to fade drastically? I know melasma is hard to treat. You're absolutely right. It's probably one of the hardest conditions that we have to treat. And the worst part about it is that there's so much internal stressors that go into it, with hormones, inflammation, even just internal heat, things like that, that we can't control as practitioners. And so that is really where I would encourage you to come in. Please schedule the Visia skin analysis. We will do a in-depth skin analysis. We'll take that 3D photo. What we can see is we can see how deep that melasma lies, because melasma, I think I also saw a question on here about, what we talked about earlier. I had melasma, and then, now it's saying that I don't. Melasma can lie at different skin layers. So we can have epidermal melasma. Epidermal melasma can lie right on the skin surface, and it's very apparent. I can see somebody across the street that looks like they have melasma. It's kind of that staining on their cheeks, the staining across their lip, on their forehead, where it's really presenting to you. I'll use myself as an example. I've had epidermal melasma in the past. I've done several treatments on it, including the Moxie laser. I've done several chemical peels. My melasma, if I were to show you my Visia skin photo, you can still see it, because now it has gone almost in a dormancy state, and it lies in the dermal skin layer. It lies deeper in the skin layers to where it's not presenting on the outer surface of my skin, but because I'm managing it so well, it's actually gone down into the dermal portion of my skin. And so it's still there. It could still be triggered, by a pregnant pregnancy or sun or excess heat, it could kind of come up to the surface. But that is a possibility where if we do certain treatments, sometimes it can suppress that melanin production, and it can kind of go almost in a dormant state if we manage it really well. It is one of those things where we always have it. I tell all of my clients, melasma is managed. It is not cured. It's something that we try to treat and suppress as much as possible. But it's one of those things that we'll always have it. Let's kind of take a look here and address some other questions. So really good question here. What is the difference between Genius versus the microneedling pen? I thought Genius was microneedling. Explain differences in results, pain, cost, and how long effects last. So Genius is what we use as our radio frequency microneedling device. And then Skin Pen is what our traditional microneedling device is. So the difference between those devices is that Skin Pen actually is a handheld device. We put a disposable tip on the end of that has 11 needles. And when we turn that device on, we can adjust the depth of those needles, and they vibrate up and down very quickly. They create thousands of micro injuries within the skin layers, and it stimulates the skin to go into healing mode to produce collagen and elastin, as you guys saw in the video. The Genius microneedling is actually with radio frequency energy. So that device is a handheld device. It has a square tip with 49 gold insulated needles on it, and it does a stamping motion into the skin. And every time it stamps into the skin, it will emit that heat energy, which is that radio frequency energy. And what it does is it creates a thermal injury. It creates that thermal injury deep within the skin layers. And it's almost like taking a defibrillator to those fibroblast cells that produce collagen and elastin, and they immediately get kind of shocked awake, and they start rapidly pumping out that collagen and elastin. So I like to explain it to my clients in the sense that it's like microneedling on steroids in a way. So if we were to normally, suggest 3 to 6 sessions of the Skin Pen microneedling, the Genius would be about 3 sessions of that microneedling with the radio frequency, because it just is more effective. Genius microneedling with radio frequency is our top treatment for stretch marks, for really textured acne scarring. We use it a lot in the lower face and the neck area for some skin laxity issues. I will say it is slightly more what we call spicy as far as pain goes than the Skin Pen is, because that radio frequency, you can feel that heat. So we do a little bit more with pain management. We numb you with a different numbing cream. We numb you for a little bit longer. The cost is also greater. So our Skin Pen microneedling cost is $349 per treatment. Our Genius microneedling for full face is $799, because it is a more intense treatment. You do get better results from that treatment, and it just has more benefits. How long the effects last, everybody's skin is different. So we can't stop the aging process. It just continues to go. We can't stop the clock. The way that you maintain your skin is extremely important. What you use on your skin every day is extremely important. I like to talk to my clients about skincare, just like we go to the gym. So we're your skin gym. 80% of your results is going to come from your home care. It's going to come from the things that you're doing every single day with your skin. You're staying hydrated. You're using medical grade products that are going to address the skin issue that you're trying to work on. And then you come here 20% of the time and you do your workouts or your treatments and kind of keep that process rolling. And then you're maintaining with what you're doing at home. So they work really well in conjunction together. And I find that clients that really follow that program and they use the right things on their skin at home, they're consistent with their home care, and they're also consistent with their treatments. They long-term have wonderful outcomes with their skin. Let's kind of look here. So this is a great question. Do VI peels help? How do I know which peel is best? So we did just launch the VI peel here at AesthetiCare. We are extremely excited about that peel. And VI peels are fantastic for pigmentation issues. The great thing about the peels, we actually have 5 different VI peel variations that we have here at AesthetiCare. And so what we'll do is we'll bring you in for that consultation, that complimentary consultation. We'll assess your skin. We'll talk about what your goals are and what you're looking to change in your skin, and then we can assess and decide which peel is going to be best for you, and we can kind of talk back and forth and see what we think. With the VI peels, they are best done in a series, as with anything that we do. Again, you can't go to the gym one time and work out super hard and get ripped and then never go again. I wish it worked that way. Everybody would be a lot happier, I think. But we say 1 is a treat with the VI peels, 3 is a treatment. So it's typically a series of 3 peels. We can do them once a month to work on those, whatever concern that you have. They work great for fine lines and wrinkles, textured skin. We can treat both active acne and acne scarring at the same time, and then melasma and sun damage, hyperpigmentation, things like that. So definitely encourage you, if you are interested in the VI peel, if you're already an existing client here, please reach out and we can set you up with a consultation with your practitioner and kind of decide which one would be best for you. And they're fantastic. We're all really loving them here. Let's take a look at what else we have here. So this one says, I get overwhelmed easily by doing all the things to my skin. How do you start slow? Consult first and go from there. Absolutely. It can be very overwhelming, especially when we're going places like Sephora or Ulta and you've got a salesperson that's saying, oh yeah, you should buy this or you should buy that. And they're trying to sell you a 10, 12-step skincare routine. It doesn't need to be like that. We follow a very simple cleanse, treat, nourish, protect routine here at AesthetiCare. Now you can make your routine as complicated as you want. I have clients who love skincare. That is their self-care every night. And they are like, I want to do, a 10-step routine and I really love doing it. Myself, I'm a mom. I have 2 small children. I do 4 steps and I'm like out the door. We got to go. So it really is about finding what fits best into your lifestyle. And that is where working with a trained professional and an esthetician or a nurse here at AesthetiCare can really kind of help to get you to your goals. We want to listen to what your concerns are. We want to help you get to your skin goals. We can make both product recommendations and then we can also make you treatment recommendations based on your budget, how much downtime that you have, how often you can come in and see us, because we understand that life is busy. We want to be able to get you there to your skin goals, in the least amount of treatments in the least amount of time. That's always the goal. But then also come up with a really maintainable maintenance plan so that you feel like it's realistic and that then you can execute it without being overwhelmed. So thank you for that question. It can get really overwhelming and I totally understand that. What is the difference between melasma and age spots? That is a great question. Melasma is a hormonal condition. So it is triggered mostly by hormones. Sometimes you'll hear it be called mask of pregnancy. So you'll notice people who are pregnant or who have recently been pregnant, they get a shadowing. It's almost like a butterfly shaped mask. It'll be on their cheeks and it's more of a staining. So when we look at age spots, they're going to be those big brown spots that pop up. A lot of times they're on our forehead, they're on our cheeks, they can be on our lower face. We think about the backs of the hands. People forget about the backs of the hands. We get a ton of sun exposure when we're driving on the backs of our hands and we get those large brown spots. And those are going to be age spots. Melasma is a completely separate condition. It is treated completely differently. Age spots we can get rid of. We can kind of zap them and they're gone. And, as they come up, as we age, we can continue to zap them and they're gone. We have a great technology called BBL that addresses both freckles and age spots, and it's fantastic for that treatment. Melasma, people with melasma, not a great candidate for BBL. It's a light-based treatment. It uses both light and heat to address the melanin in the skin, or what gives it the brown color. And that can actually make melasma worse in some cases. Not all cases, it's very client dependent, but it can actually make it worse sometimes. So we want to be really careful with those treatments. And that is really, again, I know I keep talking about that consultation, but it is so important to sit down with a trained professional, get a good look at your skin, do that Visia photo so we have a 3D picture and we can actually take a look at what exactly is causing those pigmentation issues. We can talk about when you notice them starting. If you come in and you tell me, oh, I have this kind of brown staining on my cheek and I noticed it when I was pregnant with my son 10 years ago, and then it kind of went away, but then I got a sunburn this last summer when I went on vacation to Florida and I noticed that it came out really worse. We're kind of checking boxes, and I'm going to say, yeah, I think that's going to be more along the lines of melasma. So that's really where sitting down and talking it out and coming up with a plan is so important. Let's take a look here. So we have, is there a safe laser treatment? In short, all laser treatments are safe in the hands of a trained professional. We are so big on training here at AesthetiCare. We are a national training center, so we actually bring in clinics from across the world, across the country and across the world, and we train them on advanced aesthetic practices, advanced lasers, advanced injectables. We've trained over 1,600 other clinics across the country on those advanced procedures, and so that is where, in the hands of a trained professional, all laser treatments can be safe. It is about how you are executing them, the settings that you're using, and making sure that you are providing a safe and effective treatment for your client. And again, assessing the skin is so incredibly important. Doing a consultation beforehand is so incredibly important. Making sure that we are knowing the skin that we're treating, we're knowing the skin condition that we're treating, and we're setting a proper expectation for the outcome of that treatment. So thank you for that question. Oh, it says, not a question, just want to say you have beautiful hair. Thank you. You're so sweet. This is a great question. Do treatments like Moxie or RF microneedling need to be adjusted for melasma-prone patients? Yes. So we always want to be conscious of the settings that we're using. Again, that 100% goes back to training. So we want to make sure that we're being conscious of the settings that we're using, the energy that we're putting into the skin. And then if you watched the video, we kind of touched a little bit about the pre and post treating with the cream. So we do have different creams and different topicals that we can use to both pre and post treat. So we can kind of calm down those melanin cells, where if we do put a little bit more heat into the skin with either, that laser treatment or the RF microneedling, that we're still going to get a safe outcome because we've prepped the skin, and then we're also treating the skin after to kind of recognize that heat and not freak out whenever, you get a little bit of stimulation in there. So a lot of times we will do a pre and post treatment with a short course of hydroquinone so we can safely and effectively treat the melasma with that. Now we don't always use that. Whenever we're using the laser or the RF microneedling for melasma, it is very client dependent. So we want to look at the type of melasma, the severity of the melasma, the Fitzpatrick skin type of the client, and kind of go from there. We do have procedures in the actual treatment that we use as far as cooling the skin immediately post. We have a cooling mask that we use. That's a silicone sheet mask that we put on afterwards that we have the clients leave on for about 45 minutes post-treatment. And then we also have a new cream that is by Revision Skincare. Again, one of our very nice medical grade skincare lines. It's called our CMT post-procedure cream. And that cream is actually a neurocosmetic cream. It's revolutionary in the world of lasers here right now. And there are a lot of clinics who are kind of onboarding that product. It helps to shut down the heat in the skin. It has some anti-inflammatory agents that help with shutting down swelling. It helps with your downtime. We've actually started sending our clients home with that in their post-care kits, complimentary, because we believe in that product so much, and we believe that it helps accelerate your results and help reduce your downtime so much more. And so we really try to do as much as we can in the actual treatment to help with those pigmentation issues as well. I just wanted to remind everybody, as a reminder, you'll be receiving a text message. Please reply with your preferred location with KC, Lenexa, or Liberty, and you'll be contacted to set up a complimentary consultation. We have a question here. Can anything actually fade raised age spots on the arms? I am assuming what you're referring to is what we call sebaceous keratoses, or SKs. Those do need to be evaluated by a dermatologist prior to treatment. We never want to treat anything that is new or has any sort of raised texture to it or coloration without encouraging our clients to have had a full body skin cancer check by a board certified dermatologist. So that is very important. So if you have not ever had a skin cancer check, please let this be your reminder that they are so incredibly important to get full body skin cancer checks on a regular basis. Now, if you have been screened by a dermatologist, sometimes what they'll do is they'll offer to do a little treatment in the office for you. What we like to do is we can do the Moxie laser. So the Moxie laser is great for those SKs. We can kind of plane them down with that laser. We don't always like to spot treat them depending on the skin tone and the skin type. And then if they're really stubborn, we have some cryotherapy options as well. That's where, again, kind of coming in for a consultation, we can assess the size of those age spots and the coloration of those age spots. And sometimes we do some combination therapies for those. So thank you for that question. Can you treat cherry angiomas? We can treat cherry angiomas. Cherry angiomas, just for everybody that is not aware of what that term is, they look like a little red freckle or a little red mole. So again, as long as those have been cleared by a dermatologist and you have had a skin cancer check on those and they have determined them to be benign, we can treat those very safely and effectively. So we have two different technologies we can use to treat those. We actually use the BBL. With those, the BBL attacks oxyhemoglobin, and so the red that gives those little spots the color. What happens is they turn almost like a dark purple or a black color, and then they kind of just fall off, dry up and fall off within a few weeks. Our clarity laser for our clients who are higher on the Fitzpatrick scale, Fitzpatrick 4, 5, and 6, we can use our clarity laser with that 1064 wavelength very safe and efficiently to treat cherry angiomas for darker skin tones. So thank you for that question. That's a great question. We've got one here. What do you recommend then if you have both melasma and age spots? So what our recommendation would be for both melasma and age spots, typically without seeing you for a consult, of course, and kind of assessing the skin, would be what we call Moxie Bright. Moxie Bright is a combination of the BBL and the Moxie laser. So what we do is we go in first, we do the BBL, we zap the brown age spots, we zap any reds. BBL is fantastic for those broken capillaries we get around our noses, seasonal allergies and colds, we blow our nose, we break a blood vessel, things like that. Rosacea, it's extremely effective for rosacea, top treatment for rosacea. And then we go in immediately after that in the same treatment session, and we do the Moxie laser to help with that melasma. So that treatment is called Moxie Bright, and it is a fantastic treatment for kind of addressing the overall colorations of the skin, both melasma and age spots. We have a comment here, BBL cannot be used on all skin types. That is absolutely correct. The BBL laser or the BBL device is just a light-based device. It is not a laser. So it hones in and it heats up any area that it sees melanin in, and it hones in and it heats up any area that it sees oxyhemoglobin or red. So you are absolutely correct. BBL cannot be used on all skin types. That is where the training of your professional comes into play. The BBL laser is really not meant for absolutely Fitzpatrick 5 and 6, would kind of be out of that treatment realm. Fitzpatrick 4 would be based on evaluation. So we can adjust our settings and we can treat safely and effectively, but that is where the training of your professional comes in. And yes, we absolutely do want to see your skin, because when we do have more darker melanated skin, BBL is not the technology that we would go towards. We would go towards an alternate technology. So thank you for that comment. That is absolutely correct. On average, how many laser hair removal treatments should it take to notice a significant change? This is a very wide range, and I wish I had a better answer for you. However, on average, we can say about 6 to 8 treatment sessions based on the area that we're treating. So say we're doing underarms, say we're doing bikini, legs. On average, it's going to be 6 to 8 treatments. Now, genetically, there are some people who have more hair follicles than others. There are people who have, 2 and 3 hairs that grow out of the same follicle and have very thick, very dense hair. Obviously, that is going to take more sessions to get to that 90% reduction. When we have areas that are going to be more hormonally influenced, if I'm working with clients who have underlying medical conditions like that polycystic ovarian syndrome, or if we're on any sort of hormone replacement therapy, that's where during the consultation, I'm going to set that expectation that we are going to become best friends probably. We are going to be seeing a lot of each other because this is something that we're battling an internal trigger on. So those hormones are going to be constantly activating new follicles, and I'm going to constantly be having to treat those follicles to suppress that hair growth. But on average, most of the time, without any sort of medication, underlying medical conditions, we can get to a 90% reduction within about 6 to 8 treatment sessions. That's a great question. Do you have all the same equipment at each of your locations? Somewhat. So there are a couple of devices that we don't have at both our Liberty location and our Lenexa location. I'll say our Ward Parkway location has the most amount of FDA approved devices here. But for the most part, we do have almost all of the same equipment at all of our locations. And that would be where your practitioner would let you know, if they're recommending something, if we don't have it at that location, they would recommend someone at the other location that has that equipment. So thank you. We are working on it though, always. What is the alternative to BBL laser for colored skin types? That is dependent on the skin condition that we are wanting to address. So if it is hyperpigmentation, there are several options, with the very lightest, easiest option being that skin pin microneedling. We can address hyperpigmentation, acne scarring, things like that. The Moxie laser is also safe for all skin tones and types, all the way from Fitzpatrick 1 to Fitzpatrick 6. We can safely and effectively, if someone is looking for a full skin rejuvenation, do the halo laser on them. It is very client dependent. It is something that we absolutely would need to do a consultation for. We would be probably pre and post treating with that hydroquinone cream, and we would want to be very aware of our settings that we're using. And then the VI peels. The VI peels are safe for all skin tones and types, Fitzpatrick 1 through 6. You can see right behind me here, we have a very nice example of treating hyperpigmentation with the VI peel. It's typically a series of 3. The ingredients in that peel can safely and effectively treat pigmented skin and skin concerns. And it looks like I'm kind of to the end of my question list here. Does anyone else have anything that they've thought of here that maybe I haven't addressed? I'm going to give you a second here. We've got one here. Do you recommend doing treatments on face, neck, and chest at the same time? That is completely up to you. I'm kind of that person where I'm a go big or go home kind of gal. So if I'm going to have downtime, I'm going to do it. I'm going to go face, neck, chest. And that is something that a lot of people forget about. We focus so much on our face and like, I want to do this. I want to work on this. I want to work on this. And then we forget like, hey, I'm now looking 30 here, but then these are starting to look, 45 and 50. And so we don't want to forget our neck and our chest. And so all of our treatments, for the most part, can be safely and effectively done on the neck and chest at the same time. The biggest thing that we have to consider is the amount of numbing cream that we can safely put on. So if someone is doing a face, neck, chest treatment that requires numbing, what we will typically do is we will numb you on your face and your neck first. When we go to start the treatment and we remove the numbing cream on your face and your neck, then we will apply the numbing cream to your chest. So that way we are not overloading your system with the numbing cream. So absolutely, it is a great idea. If you're already going to have the downtime, do face, neck, chest. Like, let's have it. Let's do the downtime. We've got one here. Can you explain Skin Vive? Skin Vive is an injectable hyaluronic acid based, technically filler, but it's actually not been used to restore a lot of volume to the skin, like we typically are using hyaluronic acid-based fillers. So we think about fillers, they're used in the lips, they're used in the cheeks, they're used sometimes under the eyes, temples, things like that to restore volume loss. Skin Vive is going to be more for textural issues. So it is injected very superficially within the epidermis of the skin. We do kind of a little grid pattern, mostly on the cheek area. And you think about someone who has very thin, almost crepey skin on their surface, and they smile and they get a whole lot of little teeny tiny lines here that can be more of that superficial dehydration. Hyaluronic acid helps to draw water in. So what it does is it's going to help to plump the skin. It's going to provide that superficial hydration within the epidermal tissue. So we can help to eliminate some of that crepey look to the skin. Now, that being said, it is very patient dependent. It is something that absolutely you want to have a consultation with one of our trained nurse injectors for that treatment, because, it may be something where they may recommend a different avenue than the Skin Vive for you. So definitely, if you're interested in that, we would encourage you to schedule a consultation. Do you have any evening appointments for treatments? Most of the time we are 9 to 5. I believe some of our practitioners may have some different hours, but typically we are 9 to 5 Monday through Friday. And then we do work a Saturday once a month here at Ward Parkway, and have kind of limited hours for that. But definitely, please give us a call, if you're interested in scheduling a consultation, and we can kind of go over appointment times depending on what the appointment is. Usually we can try to work something out where we can be accommodating. Can you recommend a razor or electric razor to utilize for the chin while receiving laser hair removal treatment? The razor, it's really what you're most comfortable using. I have a lot of my clients who just use a traditional shaving razor, the same thing you would use for your underarms, legs, a little bit of shaving cream. I don't usually recommend people dry shave because it can be really irritating. But as we start to do your treatment sessions, and as we start to thin that hair out and the hair starts to grow in a lot finer and not quite as coarse, sometimes people can get away with just kind of touching up every now and when one of those little like eyebrow shavers. Don't shave your whole face with those. That is not what they're meant for. Please come in and have a professional dermaplane. You will see the difference in your skin, but sometimes you can just kind of do a little touch up here. I've had a couple people asking about the credit. So our big winner of the $750 AesthetiCare credit will be chosen after this event, and you will be contacted. So we will contact you and let you know. Is there anything else injectable for moisture and hydration? In short, no. It depends on the treatment area. Sometimes we will do a hyaluronic acid-based filler injectable if someone has kind of some dehydration in their lips, because it can add hydration. When we're talking about hydration for the skin, it is very important that we are using the correct products on our skin every day for our skin type. So that is something where if you do come in for a complimentary consultation and the skin analysis, we will be assessing what your skin type is, we will be assessing what your current routine is, and we will be recommending products for you, medical grade products that are going to be really helping with the skin condition that you're concerned about. So if you do struggle with dryness or dehydration, then we can kind of address that in a way that would be realistic for you. Topical products I find really help a lot more with those skin concerns. What are some treatment options for people with dark spots and cystic acne? Cystic acne and acne in general is one of the hardest things that we treat. I'm extremely passionate about treating acne. I've struggled with acne since I was 13 years old, have gone through, all of the dermatologist things. I did Accutane in college. I still struggled with it. I still struggle with it hormonally at 38. And so it's something that I'm really passionate about. I think there's a lot of stigma around acne, and there's a lot of miseducation about acne. And so I really love to sit down and do a full consultation with my clients about acne. It is so incredibly systemic. There are a lot of internal causes and a lot of external causes. And so what we do is we sit down and we talk about kind of what we're doing now, what we can do. We assess, supplements that you're taking, vitamins you're taking, medications you're taking. And the biggest thing with acne is going to be skincare. How you care for your skin, what you put on your skin on a daily basis is going to benefit you so much more, and how you maintain that than coming in, once a month and doing a treatment. Obviously, the treatments are incredibly important. Chemical peels are where I start most people at for both treating acne and acne scarring. The VI peels are incredibly effective. You can see kind of behind me here with some acne treatment with the VI peels. We can both address active acne and acne scarring with those peels. So if you're struggling with that, I empathize with you. I would love to sit down and talk to you about some options that we have, and hopefully kind of get on the road to some clearer skin. So please do give us a call. Name the C+ you spoke about from Revision. That's the Revision C+ Correcting Eye Complex. And we have that product here, here at AesthetiCare on our retail shelf. Okay. It looks like we've kind of come to the end of our questions here. So I just want to thank everybody for attending our live event today. Thank you so much for sending all of your questions in. This was fantastic, being able to sit here and talk with all of you. Please do give our office a call and respond to that text message on the location that you would prefer to go to. One of our front desk staff will reach out to you and get you scheduled for a complimentary skin analysis and consultation with one of our estheticians or nurse injectors here. And we would love to see you here at AesthetiCare. Thank you guys so much. Bye-bye.